7:15, 92.5 ABC Central Coast. Terrigal is going to be the venue for a fantastic event coming up in October. It's the 2015 National Men's Health Gathering, and it'll specifically focus on areas of men's health, Indigenous health, all the things that need to be done to make men happier and healthier, basically. It's a big issue too. Mental health, cancer, lifestyle diseases, all the things that we can change for the better. It's October 20 to 23 at the Crown Plaza in Terrigal, and we're going to be broadcasting live from many of the events and bringing you some great experts with terrific knowledge. Joining us, one of the people who will be instrumental in getting it all together, Matt Stubbs, Head of Research and Service Development at Interrelate. And just before we get into the big conference, Matt's going to give us a bit of an overview of what Interrelate does here on the coast. G'day, Matt.
G'day, Scott. How are you?
Yeah, well, give us the Interrelate story.
The Interrelate story. Well, Interrelate's 90 years old next year, so we've got our birthday, and we started off. It's interesting, as a result of 100 years since the Anzacs. Well, 90 years ago, there were three blokes who sat there and went, you know what? There's lots of dads who aren't coming home to teach their boys about sex and teach them about what it means to be a man. So we need to do something. And so they started up the father and son movement. And so Interrelate, since that time, has been involved in providing sexuality education in schools, and we still do that today. So that's sort of our history, where we came from.
It's interesting how you developed when there was a great need in society. It's an aspect that was probably totally overlooked by the government, who sent so many young men to their death and men of all ages to their death. And so all of a sudden you've got a whole nation of boys with no father figure to teach them about the whole fact of life.
Yeah, and I think it tells a tale of Interrelate. We've always tried to be really cutting edge, and you would have thought 90 years ago to be going into schools and to try and teach sexuality education, that would have been pretty risky stuff.
Yeah, that wouldn't have been approved by many sections of society.
Yeah. So, and from there, I suppose we've evolved, and ultimately now our role is we see ourselves as strengthening family relationships, and so we do that through offering counselling. So we offer individual, family, couple counselling. We also then were funded at one stage to run the Family Relationship Centre. So that's where, if mum and dad separate and they need to work out arrangements around the interests of their children, so to try and work out what's best for their kids at this difficult time.
Gee, that's an important job, isn't it?
It is. It's an important job. It's a really hard job, Scott. Our mediators across New South Wales are fantastic. The mediators here on the Central Coast are awesome. It's a really difficult job, but it's a job that sees some really good outcomes. So mum and dad don't end up in costly legal battles, but rather they come to one of our centres and they try and eventually sit at the same table and work things out in the best interest of their children. And there's lots of courageous parents out there who take that risk of saying, no, I'm going to try and push through my personal stuff and focus on the needs of my children, and that's what our aim is.
Beats the hell out of using up all of the money that should be there to feed and clothe and educate the kids in lawyers' fees.
Well, and the other thing is that takes time as well, Scott, and what we know is that for children who live in conflict in an ongoing way, it has terrible outcomes for them.
Dr. John Irvine was saying that divorce isn't the problem. Kids can accept that. It's mum and dad fighting.
Yes.
That is the impact that creates the damage.
Yeah, no, 100%, Scott. Yeah, very much so. And so we offer family mediation as well in some of our other regions, but not here on the Central Coast. We also have the children's contact centres where, either mum or dad are seen to be a parent who should have contact with their child, but they need someone to supervise that. So we run those centres in other regions, but we don't do that here on the Central Coast. The other thing that we do have is in each of our regions we employ Aboriginal community liaison workers who engage with community around issues that are affecting community and seeing how they can help that community come to the different helping services that we offer. So here on the Central Coast we work pretty closely with a number of the Indigenous organisations like Mingaletta down at Umina Beach.
Yeren, they're very good, aren't they?
Yes.
20-year anniversary this week.
Yes. I heard Roy RC on the radio the other day. And look, it's fantastic to see the work that they're doing with Aboriginal community around gambling, because I think, again, that's a big one that has gone unseen for a little while.
Seems to be... Well, it cuts across all genders and demographics, but it seems to be more of a problem for men.
Yes.
I don't know if they're a statistics to back that up? What?
Yeah, look, I think it'd be fair to say, Scott, that across a lot of indices of health and well-being, men do less well than women. We know that we're going to die earlier than our female counterparts. We know that we're going to get earlier onset of a lot of diseases, and we also know that rates of drug dependencies and even dependencies around gambling are higher for male populations as well.
Sadly, women are catching up in smoking, which is
yes.
not good. But this big event too, it's got a corroboree, so there'll be an Indigenous focus as well, which is great. Yeah,
so the gathering pulls together two conferences. It's the National Aboriginal and Torres Strait Islander Male Health Forum, and then it's also the Australian Men's Health Conference. And so what we've tried to do is to bring those two conferences together. They're still a little bit separate, one day at each end, but they have 2 days in common. And what we heard last year from the Aboriginal fellas in particular saying, men's health is everyone's business. We need to share the knowledge of what's working in different communities and come together and listen to one another. And one of the reasons why, I suppose I initially thought this would be great to have it on the Central Coast was I think we do some fantastic work with men on the Central Coast.
I mean, the men's shed movement here is gangbusters, isn't it?
Yeah, and people like Kim Hopkins have done a great job.
Wonderful bloke, Kim.
Yeah.
And the funny thing about men's shed, they have such a great impact on men's health, but there's absolutely nothing pushed down their throats. You go there and the message is almost, telepathically passed on. It's more about talking to each other, and then there's once it turns into a clinic, it's ruined. It's never going to be that.
Yeah, and that's what we know in working with men. There is a dead set furphy out there that men won't talk about issues. Men do talk about issues. I've been involved in a number of different programs where men are openly talking about what's going on in their life.
Just in the right context.
It needs to be the right context. So at the moment, down Minguleta Way, our Aboriginal and Torres Strait Islander community liaison worker, Stewie McMinn, is facilitating a men's depression group with Aboriginal men. Now, a lot of people say, I don't know. And they're men who are sort of 40, 50, 60 years age, and they're openly talking about the struggles they have with depression and mental health. So, men do talk. We just need to be providing the right forum. And what we're hoping at this gathering is that we're going to provide a forum where different speakers can come together and certainly talk about what they've found to be working in the area of men's health and well-being. The uniqueness, I think, of this gathering is that we're not just going to sit in a room, and that was the Aboriginal fellow said, we need to get out of the room. And so, as you've already spoken about, we're going to have a national corroboree. So we've got fellows coming, dance groups from all over Australia are going to come here on the Central Coast in October. I can't disclose the venue quite yet because we're in negotiations around that, but it will be a fantastic night. And then the next day, as a core part of the conference, we're actually going out on country, and Gabby Duncan and Paul Gordon are going to be taking us to different sites on the Central Coast and talking about the importance of that for not just for Aboriginal men, but for all men to understand this land and to understand their belief around how this land came about and what are the lessons that we can learn from that. So we're talking about this conference as being old knowledge and new knowledge coming together so that we can have happier, healthier men, which ultimately means happier, healthier families.
Matt Stubbs, it's terrific stuff. It's great that Interrelate is involved as well, and we'll have lots of great people to talk to in the lead up to that and during the event as well. And after that, the National Aboriginal Medical Centre get-together in November too. So we're really doing good things here on the coast. Thanks for joining us.
No, look, thanks for your support.
Matt Stubbs there from Interrelate. Isn't that a fascinating history, how that organisation formed 90 years ago when so many boys were left without fathers and no one to teach them about sex or how to live as a man, and so they formed the organisation to give them that information 90 years ago as the fathers and father figures didn't come back from the war. Amazing history. 7:25, 92.5 ABC Central Coast in crisp, clear FM. You'll hear